Hi guys, it's Dr. Jen Caudle, and I'm back with the Be Your Own Doctor Health series, but today I'm actually talking to med students. That's right, this is for you med students. I'm giving you tips on how to perform amazingly on your med student rotations during your clinical years. Now, just a little bit about me. I am a family physician, board certified. I'm an osteopathic physician. Oh, by the way, I have a video on why I chose osteopathic medicine as well, so peep that if you're interested in DOs or learning about what DOs are. But I digress. But I've been in practice for 10 years. I'm an associate professor at Rowan University School of Osteopathic Medicine in Stratford, New Jersey, and I'm the co-clerkship director for the Family Medicine Clerkship. So I teach third-year medical students, and I run the clerkship, et cetera, yada, yada, blah, blah, blah. And I actually really wanted to come to give you some tips that I actually give my very own students during our orientation. Things I think might help you, will make you look like a rock star. So anyway, that's what I'm here. That's what I'm here to do today. But I have lots of videos on this channel, and I always tell folks, if you are interested in health news that you can use on a daily basis, or you kind of are interested in that quirky health stuff you've always been kind of wondering about, or you're interested in celebrity health news, or maybe stuff for med students and residents, and other attending physicians, well, I'm your girl. Make sure you click the subscribe button and hit the little bell to get updates. All right, so let's just jump right in. Okay, my first piece of advice for med students who are on their clerkship rotations is to read the syllabus. Yes, ladies and gentlemen, please read your syllabi. To be honest with you, my syllabus for my course has a lot, almost every question I've ever been asked by students in my clerkship is answered somewhere in the syllabus. It's really, though, important to read it before you start rotations, or at least that first week, that first night or two when you start rotations. So it helps you understand really what you're dealing with, what's expected of you, how you should function, who you should contact, etc., etc. Read that syllabus. You'd be surprised how many people don't. And oftentimes, as attendings and as clerkship directors, we can tell who reads it and who doesn't. So make sure you take a look at it. My next thing, and these are in no particular order, by the way, these are just as they come to my mind. The next thing, this is again what I tell my own students, is don't be late. That's right. Don't be late. Treat your clinical rotations like you would treat a job. Be on time. If you get sick, you get a flat tire, something happens, you call the appropriate people right away, not at 2 in the afternoon when you've been sick and missed most of the day of rotation since like 6 or 7 in the morning. You jump right on it. But the important thing is, don't be late. Trust me, your attending might be late, your residents might be late, other students might be late, but don't you be late. One thing I always say in medicine is that our reputation often precedes us. You know, attendings and residents talk, for better or for worse, and oftentimes the behavior of a student will carry through, and other people will have information about you, whether you like it or not. It's best to set a good example, show that you're interested, be on time. So this next suggestion is something that I give to all of my students as well, which is to be interested. You know, I'm a family medicine clerkship director, but I know that all, and in fact, most of my students in my clerkships don't want to do family medicine. I know you might want to do ENT or cardio or ortho or you name it. I know that, and that's fine. By the way, for us docs, it's not personal. We want you to do what speaks to your heart and to your mind. But the idea is, and this is something I did when I was on rotation, treat every rotation like it's something that you want to do. In other words, just because you're on peds and you want to do cardiothoracic surgery doesn't mean you blow off your peds rotation. Seeming disinterested, being unengaged, not taking full advantage is definitely a no-no, and it's a red flag. Your attendings will absolutely notice. But the bigger issue is how it's going to affect your education. You know, something I say, for example, about family medicine is that family is a great rotation to get a lot of those procedures you may have never done before. Setting up a nebulizer treatment, checking blood sugars, giving shots, doing hemocolts, dipping a urine to actually see how the nurses do that. If you look at every rotation as an opportunity, you are going to learn so much more than that student that really kind of blows off the rotations that they don't think is really critical to what they ultimately want to do. Remember, the more you do, the smarter you're going to get. So be interested and treat every rotation like it's a potential contender, whether it is or not. My next suggestion is to read something every night. I know you're on clinical rotation, so it's not like first and second year. Yes, you can go out to eat and go to the movies and spend time with your friends and have a little bit more of a normal semblance of life than maybe you've had before. But you need to read something every night, okay? And one thing I always suggest is to pick a patient or a few patients that you saw that day with conditions that were really interesting or stood out to you for some reason. Maybe it's a patient with hypertension who's already on 4 or 5 antihypertensives. Well, that night, why don't you read about secondary causes of hypertension? Or maybe you saw an unusual skin rash or a mole. Whatever it is on rotation, take 30 minutes or so, if not more or less, and read about different topics that you saw that day. Not only is it going to help your studying so that at the end of the block rotation, you're not going to be scrambling to study for your final exam, but it's also going to help you associate conditions and treatments, etc., and diagnoses with patients you're seeing on rotation. And of course, we know it's kind of like a mnemonic, right? You likely won't forget that. My next and last suggestion is something I did as a medical student. I actually got these little notebooks, like little square notebooks that I would actually keep in my white coat. And it gave me an opportunity. And maybe you want to write things down in your phone, like your smartphone or things like that. That's totally cool too. But just have a place where you can jot down notes, things that you want to remember that you don't want to forget, tidbits, etc. And keep that notebook or the note on your phone or whatever and add to it. And that will help you not only kind of keep track of what you're learning, but it'll also help you be an engaged learner when you're on rotations, that you're actively sort of assessing and thinking about what you knew, what you're learning, and it will help you grow. And it'll also be actually a great resource for going back and taking a look at these tips later on. So that's it for now. I hope these tips were helpful. Remember, you can be amazing on your med school rotations. It just takes a little bit of work, but I know you guys can do it. Remember, if you want more of this type of content, or if you want like health news that you can use on a daily basis, or you want to learn about that quirky health stuff, or even celebrity health stuff, yep, I talk about that too, make sure that you click the subscribe button and click the little bell to get updates. All right, thank you.